Together we achieve victory over heart failure.
I'm Dr. Vimlesh Pandey, and today we are delving into a silent epidemic that in India is combating heart failure. In India, the majority of patients grappling with heart are surprisingly young individuals. It's a common occurrence in to witness young adults seeking medical assistance for heart failure, unlike the Western countries where heart failure is predominantly a disease of the elderly. So let's break down five essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have heart failure? So when people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently as it should. So the ejection fraction or EF measures how well your heart pumps blood. It is the amount of blood pumped out of your heart's lower chambers, which we call it as ventricles, each time it contracts. So while a normal ejection fraction is around 50 to 70%, individuals with heart failure typically have an EF of 30% or lower. So secondly, why are so many Indians affected by heart failure? So genetic play a significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, smoking habits, this worsen this epidemic. So moving on to what are the signs and symptoms of heart failure. So basically watch out for breathlessness or dyspnea on exertion, which is most common symptom. Sometimes it can present also as confusion or easy fatigability or heart palpitation or loss of appetite or vomiting. So how can we protect ourselves from this disease? So our hearts work incredibly hard to keep us alive. There are five golden rules which we can follow to return this favor. So early detection of heart failure through regular blood test, dietary adjustment to maintain heart health, incorporating daily exercise into your routine, practicing stress management technique, and quitting alcohol, tobacco, and smoking. So, lastly, what comes next after a heart failure diagnosis? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medications improve quality of life and longevity. Devices like bioventricular pacemaker, implantable cardioverter defibrillator, and heart wall repair or replacement are the option we have. And the last resort to the treatment is the option of heart transplant. So the lifetime risk for cardiac heart failure is 1 in 5 for both men and women. So remember, awareness and proactive measures are key in combating this silent epidemic. Thank you.